You've just gotten over a bad bout of the flu, and you're still feeling a little weak, but hey, you just spent the last 7 days lying in bed and coughing up phlegm. Your body's bound to be tired. It's not until a couple of weeks later, when you've still retained that cough, plus you've developed some chest pain, maybe you realize you're not done being sick. And your doctor confirms your suspicions. You have pneumonia. Now, it's not a continuation of the flu, but pneumonia, an inflammatory infection, has a knack for invading your lungs right after you're done with the flu, or even a cold, when your defenses are the weakest. Normally, your body's able to keep these invaders out of the lungs, but once your immune system is preoccupied with mending its latest battle wounds, pneumonia-causing bacteria take the opportunity to slip into your lungs' air sacs. The bacteria's presence forces the body back into battle mode and makes your lungs the inflamed base of a growing pile of bacteria, body-defending proteins, fluid secretions, and the source of all your symptoms.
Well, the symptoms can be quite variable. The classic is fever, usually of abrupt onset, cough, sometimes blood in the cough, chest pain. People need to be aware that severe fatigue, weakness, sometimes people have joint pains, can really represent signs of pretty significant inflammation and pneumonia.
Ironically, those who are at the greatest risk for pneumonia, the elderly or people with weak immune systems, are the ones most likely to present with milder or fewer symptoms, and are therefore much more likely to be written off as just suffering from a mild cold. It's for that reason, then, that the symptoms should always be considered alongside an X-ray.
Usually the lungs are represented by black, which means that there's a lot of air. If the air disappears because it's filled with swelling, fluid, blood, it turns white. So we look for these white patches on a field of black. It's really bruising of the lung is what we're seeing.
The source of your pneumonia can be one of three things. Viral, which, like the flu or the cold you had before this, needs to be treated with rest and fluids. Fungal, which is handled with antifungal medications. And the most common, bacterial, which requires the use of antibiotics. Now, the one thing that all these three causes and treatments have in common is time. It's going to be a while before you're back to full health.
Most people are under the impression that an antibiotic will make them better within less than a week. But in fact, most people will require at least a month and sometimes 3 months until they get back to themselves. There's a prolonged period of fatigue where people just don't feel themselves after an episode of pneumonia.
Doctors will also recommend some over-the-counter medications like ibuprofen to handle the fever and aches and pains. But unfortunately, you have to suffer through the cough. It's one of the body's best ways to clear the bacteria out of the lungs. Sheer aerial force. But you can prevent the pain of pneumonia whenever you prevent the flu.
Primarily what we need to do is use influenza vaccine because most pneumonias are usually preceded by an influenza infection. So if we prevent influenza by taking the flu shot, we can prevent the flu and then prevent the secondary pneumonia. And there are lots of studies and lots of evidence that show that influenza vaccination by whatever route prevents pneumonia.
Pneumonia is a product of inactivity. This is because anytime you succumb to extreme inactivity, where you never get out of bed, it makes it easy for the body secretions to build up in the lungs and become a sort of breeding ground for bacteria. So even if the flu has you totally worn out, it's important for you to get up and take a few laps around the house every once in a while to get the lungs working again. You don't want to spend the next 3 months with the flu ×2. I'm Dr. Keller Wortham, and you're watching the eHealth Network. We'll see you next time.